Hello, everybody.
Hello.
Your first one is should be in front of you, or if you can see up here.
Just as a little background, folks, so you might be able to understand more easily. I've had one vacancy that is at 95 and change since this spring. And as of this past week, I have another vacancy.
We approved both of these on an emergency basis.
Yes, and this year it's just the upgrade 86, so I'll make a motion to it.
I'll second. Discussion? All in favor?
Aye.
Opposed? Carried.
This second one, correct? Make a motion.
I'll second.
Can we at least read them?
Okay. Again, these are the resolutions that we did the emergency.
Yeah, we
first.
have to read. Oh, we already read that. You got it.
It says the district attorney requests authorization to create and fill effective September 2nd, 2022, one ADA position full-time at a starting salary of $86,700, and the insurance waiting period be waived.
Do we have folks lined up?
Yes,
Excellent.
thank you.
So we have a motion in a second.
All in favor?
Aye.
Opposed? Carried. And I think this resolution we're gonna hold off on?
If I may withdraw that one, Chairman?
Yes. Thank you.
Okay.
Okay.
You're all set, Mr. DA. Paul, you're all set.
Thank you.
Thanks, everybody.
Thank you. Next on the agenda is MIS.
Get the hot seat. Hello, everybody. Just requesting to fill two project manager positions. I'm sorry, project coordinator positions. I had one vacancy due to a promotion, and the other, the individual went to another agency, so I need to fill those two.
I'll move it. All in favor?
Aye.
Opposed? Carried.
Thank you. Have a great day.
Thanks for your help, Chris.
Next, DSS.
So first request that I have is to fill one caseworker position vacant due to an employee's resignation, which was effective 8/26/22. And, you know, I could say that it's vital to the day-to-day operations of the agency, but I think everybody here knows that.
Discussion? All in favor? Aye. Opposed? Carried.
Thank you. Okay. There is currently one clerk typist position that is open, and the previous employee had accepted a position with another within our department, but went to another position. So we seek to convert that clerk typist position into a community services aide, same grade, same salary. This is in keeping what we've been doing. We've been converting that position over to CSA because CSA actually can do more work than the clerk typist position, and it's at the same grade.
Discussion? All in favor?
Aye.
Carried.
And finally, for as long as I've been commissioner and my predecessor was commissioner, we had on our payroll a medical consultant, essentially, a Dr. Johnson, who I'm not here to impugn his work. I'm sure he does very fine work, but it's just something that if we need, we can certainly contract per diem, and there's no need to have that on the ongoing payroll. So I just asked for a resolution removing the doctor from our .1 payroll. It's low. It's about 7,000 a year.
Is he currently in the position?
He is. It's not needed. It's not needed near to the extent that would require an ongoing salary. I'm not sure we would pay, and I'm not including any work, but I'm not sure if we did this on a per diem basis, we would ever get to 7,000 in a year. So just looking to save some money. It is.
He would contract for services as needed.
And it may well be with Dr. Johnson, you know.
Move it.
All in favor?
Cost savings? Aye.
Opposed?
And that's all I had. Thanks so much.
Thank you. Next is Sheriff Pratt. Tanya Governor.
Yep.
Hello, everyone.
Hello, sir.
Nice to be in person again. We had three resolutions we'd like to present today. One kind of piggybacks off of Director Gibson's request, and that's to abolish a part-time physician assistant's position, a physician's position, and also a per diem LPN position. The physician assistant's position is $49.50 per hour. The physician is $68,556 salary per year, and the per diem LPN is $31.32 an hour. This is a result of the MAT legislation and moving to the prime care vendor services.
I'll make that motion.
I'll second.
Discussion?
Sheriff, I assume one's gonna, end right when the other one starts, so it's not being overlapped.
That would be correct.
Any other discussion? All in favor?
Aye.
Opposed? Carried.
The second request is going to be the authorization to fill a recently created a base salary for that is 40, and that was based on a resignation.
I'll move it. I'm sorry.
Communications or corrections?
Oh, I'm sorry. I think I skipped ahead. Let me go back to the communications position. Create a full-time corrections position. Or excuse me, it's been a long day. Communications officer position. So the communications officer position is a result of we're having a lot of overtime within the communications department in our office. We're currently filling that with road patrol officers, which is creating a deficit in our employee pool to fill our vacancies on the road. So if we have a vacancy in communications, we can't fill that with a communications officer. We take from the road, which now reduces the amount of people we have to staff the road patrol, minimum staffing, and also reduces our force pool if we have no one.
Fully staffed. No vacancies. I don't know why is there a shortfall?
Well, we did have a plethora of part-time officers at one given time or another, and that pool has been drastically reduced.
So funding for this is going down to part-time salaries that budgeted funding for position. How we're paying for it.
That would be preferable, yes.
What is the role, when you say communications, like within the department, are we talking like social media and PR? What type of communication?
Yeah, this is dispatch. So this is the hub that answers all the phones, dispatches our patrols out to calls, and they also deal with the input and communications of warrants. They deal with orders of protections that come in to make sure that they're filed and sent out to the patrols in a timely manner. You know,
So if it's a new position being created, are you saying that the workload in that office has increased for some reason? Or, like Jim said, you're looking to take multiple part-time positions within the department and transfer it over to a full-time?
well, our part-timers can only work 720 hours per year. There's a lot of overtime that we're currently dealing with within the communication center, which we've dealt with for years. This year, we're coming very close to the 720 hours for the two part-timers that we have that have been working on a regular basis, which is going to create even more overtime for the remainder of the year. We've been trying to space them out to 2 shifts per week to draw that 720 hours through the year. However, we're continually forcing members from both communications and the road patrol to fill these vacancies. With a full-time trained communications officer, we're now filling this vacancy with someone who is trained specifically to do that duty, not taking someone from the road, and not someone who's just doing it part-time. Not saying that the part-timers aren't doing a fantastic job, but we can only use them for such a duration. Sometimes we have deputies who haven't been in the communication center in some time. That could be months. And now they go and they take the vacancy, or they're forced into that vacancy. And, with an already overstaffed road patrol, or I shouldn't say overstaffed, but overburdened road patrol, the burnout rate is continuing to rise. And we just don't want to have mistakes with dispatching to the wrong address, not getting that information out in a timely manner. We just want to have it so it's a more professional, and a member in there who's doing it on a continuous, regular basis and is trained to do specifically that job.
But if I understand correctly, you're saying that the overall staffing in the communications department, I understand that you're pulling from elsewhere, and that's great. Your overall staffing in the communications department, you're looking to.
Yes,
It
correct.
is not, even though it's fully filled, it is not adequately staffed, and we need to create another position, but you're not abolishing other communications positions.
We are not.
You're getting rid of the need of having to pull in from other departments.
Correct. Correct.
My question would be, have you identified the money to be able to fund it?
Well, the reduction in the part-time communication budget obviously would alleviate some of this burden. Obviously, would not alleviate all of it. We do have 2 dispatchers, 2 part-time dispatchers. One that is currently on a civil service list. That position, if in fact we filled it with that particular dispatcher, we would abolish that part-time position. And obviously,
non-budgeted position.
correct.
Do you have
Obviously,
somebody in mind for this position?
we do have 1 part-time dispatcher who is currently on the list. Yes, we'd have to go off the civil service list, obviously, but it would also offset the overtime budget.
And did this position also make it into your budget request for next year? Obviously, we're talking about how to pay for it for the rest of this year, but is it a position that you put into your,
This position was not budgeted.
for next year either?
Correct. Raised by the continual forcing and the amount of, I shouldn't say overtime, but the amount of hours left that the part-timers have, which we're going to exhaust probably by next month.
Can I make a recommendation to amend this request to be, it would be contingent on identifying funds to fund the position,
So
not only this year, and that you also make the controller aware about next year so he can add it to the budget.
You're
absolutely.
saying he has to find it within his budget from somewhere else?
This year you have to raise.
If you are abolishing a part-time position, that covers a majority. That would cover a portion of it right now, but you just need to spell that out in the resolution.
Okay.
I'll make a motion that we move the amended resolution.
I'll second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And now the corrections position. We're requesting the authorization to fill a vacant but budgeted full-time sergeant's correction position with the exception due to resignation on September 11th.
Move it.
All in favor?
Aye.
Opposed? Carried.
That's all I have. Thank you.
Thank you, Sheriff.
Chair, thank you.
Next, fire coordinator.
Yes, everybody. We're We're looking to fill a budgeted vacant deputy fire coordinator position and have those responsibilities be to develop more in-house training with our county instructors to kind of make us a little more nimble in our training programs and do a little better job of getting some classes out there for the volunteer firefighters. We're using the state programs and they're still filling up, but we're noticing that we're not filling them up as quickly as we used to, and we think some of that is due to the length of the courses and stuff. So we're kind of devising a whole different way of looking at it and trying to get more distinct training in smaller pieces, so it's more acceptable to some of the volunteers to be able to make it.
Is this position open because of resignation, or is it just budgeted and never got filled?
It's been budgeted in for we've been talking about this for a while, but we never filled it.
All right.
I'll second it.
Motion and second, further discussion? All in favor?
Aye.
Aye. Opposed? Carried.
Thank you very much.
George? Next is solid waste.
Good afternoon. Hi. Requesting authorization to create and fill a senior account clerk position in our department. We will be abolishing existing bookkeeper's position due to retirement, and it is a $4,700 cost savings.
I'd like to remind everybody that this position has been budgeted but not filled for a year and a half or more.
Yep.
The bookkeeper position.
I'll move it.
Second. Discussion? All in favor?
Aye. Aye.
Opposed? Carried.
Thank you.
Columbia County Treasurer.
Yes, that's
He's gonna spend the money she just saved, don't worry.
Just the opposite. I'm going to save.
All right.
I'm going to save money like I always do.
I know.
Okay, all right. Just one resolution request. We had a resignation of our billing specialist that does all the billing for our mental health department. So I'd like to upgrade our senior account clerk to the billing specialist position. And in so doing, we're going to save about $5,300. Save, Ron, save.
Okay, see that's it.
And he'd be
You
able
beat
to
Joey.
fill the backfill that's created in the.
Not yet.
promotion.
Not yet. I'm just going to keep a position open in the 23 budget
Okay.
to find out what we're going to need.
Move it.
Motion?
Second.
Second. Discussion? All in favor?
Aye.
Opposed? Carried. Next is Health Department.
Okay. Looking to fill a vacant public health technician position. It's been vacant for a time. It is budgeted. I'm anticipating a departure in emergency preparedness in 2023 and doing research on that chore, on that job. We find that many health departments are moving to environmental health to do that function, and rather than have a standalone position. I would anticipate, not that I will be here, but I would anticipate in 2023, perhaps considering abolishing that position. But in the meantime, it keeps me up at night, not having someone in a redundancy there to learn this job, considering the tenuous situation we find ourselves in. And so bringing person on board now would allow this person to be trained up. And we also are discussing, we're behind on our soils program, our septic system program. I've got my environmental director doing some of that work. I'd like this person to be trained up to do that as well, to take the heat off of her.
Why has this position been open?
It's been open for,
Lack
the needs were different. The needs have changed. The needs were different. And actually, if you go back in time to the time that I moved from being a public tech myself to director, this position's been open that length of time. So it's just the needs of the department have changed at this point in time.
Is there an actual job description?
Hmm?
Is there an actual job description?
Oh, yeah.
This is a hybrid.
I
It's,
know you know what you it needs to be,
yeah.
but I'm saying that can somebody read it and say, oh, this is me or not?
All the technicians have the same job description. This one, because it's going to specialize in public health preparedness, we need to rewrite it to include that in there. But they'll still be responsible for the rest of the stuff that technicians do. So we do have to rewrite it.
You have someone in mind, or are you just gonna have to?
We do have a candidate. We do have a potential candidate. And again, that helps me sleep at night, knowing that I'll get somebody in there sooner rather than later.
And will you still advertise it to the public?
Oh, yeah. And there has to be a test. A test will have to be given, and the individual will have to pass the test. So that we recently hired in a gentleman who's working out really well, really great. I don't know, 6 months ago, 8 months ago, we advertised for a tech. And back when I took the public health technician, there were 40 people in the room taking the exam with me. And that wasn't that long ago. When he took the exam, he was the only one taking the test. And it's just a sign of the times. So we will advertise for the position.
I'll move it.
I'll second.
All in favor?
Aye.
Opposed? Carried. Thanks, Jen. Next, public defender. Last but not least.
Afternoon, everyone. I have one request. I'm requesting permission to fill a family court assistant public defender position. This position will become vacant September 30th of this year due to a resignation of an assistant public defender. Requesting salary be in the range of 70 to 85,000 plus fringe, commensurate upon experience.
How does this fall in line, Michael, with our other attorneys?
It would just depend on the years of service or admittance to the bar, however you want to look at it.
Is this gonna be funded with, Dale Herring money, or this is completely out of the county fund?
This is the vast majority, the overwhelming majority is just budgeted by the county. There's a small amount under one of the grants that's added on.
We have a motion and a second. Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you, everyone.
Thank you. Okay, is there any other business?
I think we're sharing.
Let's,
Anybody who's get a micro calendar meter.
I thought it was just. I think you're during the meeting, I don't know what's going on today, but when we have these meetings, it's hard. Maybe we can go back to the video and show them what's on.
Yeah, no.
No? Don't like that?
This method, people.
can we can look into it. We will look into it and see what's available. Maybe we'll give you a megaphone.
Yeah, we're up there. Yeah.
You want to take a camera? Whenever you're ready, Jack. Whenever you're ready.
Okay, first resolution, we had a contract for a very long time with Smart Health Claims. It became unsupportable by our MIS department. They indicated we needed to switch, which we did, to a company called Medent. We have a lot of records, though, that are in still Smart Health Claims. It's been sold a couple of times. This current outfit, Mitchell and McCormick, owns it. They are going to charge us $4,000 to extract the data so that we have those records accessible through on a thumb drive. So that's what I'm asking for us to do, is be able to recover those records.
We have a motion and a second, any discussion? So moved.
Okay, so I'm looking to fill a vacant public health technician position. I'm anticipating a retirement in 2023, and it would be to the value of the department to be able to fill the technician position now to learn what this individual knows about preparedness, public health preparedness, and also to help us train another person to help us with our soils or septic system inspections.
I'll move it.
Second.
All in favor?
Aye.
So carried.
Okay, this is another opportunity for our preschool program to add to the providers in the community to help with evaluations. In this particular case, it's the Germantown Central School District that can help with evaluations of their students. And as I've told this committee before, we do have a shortage of providers, so being able to do this with them would be a real plus.
I'll move this.
All in favor?
Aye.
So carried.
Okay, so this is the purchase. We've had, as you know, we've had the Abbott machines in the school districts this past year to test for COVID, point of care testing. So a student would come in not feeling well, be tested for COVID, and then we have results in 15 minutes. The school districts have expressed a desire to keep these machines to the next school district. This is supported by our ELC grant, the $1.5 million grant. The school districts have learned that they can also test for strep and the flu utilizing these machines as long as they get the right reagents. So they want to be able to do that as well, would be a real plus. We purchased some of the machines and we leased others. We want to buy the leased machines at a cost of $2,500 a piece. And again, supported by our ELC grant.
Second,
I'll second.
any discussion? All in favor?
Aye.
So carried.
That's my resolutions. Anybody have any questions?
I allowed to ask the question.
Sure.
On the machines, I think it's such a great service that the schools have the ability to test, not just for COVID, but now for other things as well. In New Lebanon, we have a real lack of healthcare access. The closest clinic or doctor is a half-hour away for things like these tests. Would there be any possibility for me to have discussions with you? For example, if the school nurse was willing on Saturdays at the town hall or something, could a conversation happen since they're your machines with the proper staffing and testing that the town would provide to open it to the community that's not the school community?
Well, again, we are purchasing the machines, and I suppose you could say there are machines, but we've essentially given them to the school districts.
So they do.
So I think that would be a decision if the nurse wanted to do that. That would be a decision. And then the tests themselves for COVID are $41 a piece. That would be something that we would have to look at. The school district would have to look at in terms of reimbursement. I don't know how much it is for the strep or the flu tests, but probably less.
The conversation with the
Yes,
school.
I would.
Include you.
Yep.
Okay, we actually designated some ARPA funds for increasing health and wellness access, so as far as buying tests.
I think it's a good idea.
Okay, great, thank you.
Jack, are we seeing any kind of shift away from not from 100% COVID, but I mean less testing, less anything coming down from the state that's just less of what we've been doing?
Well, we haven't really received any new money, any new COVID money. We're working off of COVID money from last year. Back at when things were at their peak, we were testing 50, 60 people in the department. In August, we tested 8 people. So I think that, people aren't coming necessarily to us for testing. On the other hand, last week, as you might have seen the press release, we had a big bump up in our positives. And the only positives we know about are people who are testing at a community site. In other words, we're not recording home tests. So we had, with this big bump up last week, it's people who go into Well Now or CVS or whatever and getting tested. It's kind of settled back down again. And as reported in the release, the biggest part of the bump up was Barnwell. They've got quite a outbreak going on there.
We gave out twice as many tests in the last 2 weeks as we've given out in the prior 4 months. It's been springing up.
Yeah, and I think that it's out there. I think, when you look at, we had 33 positives today, 24 yesterday. It's probably twice that or more. And it's people doing home tests and not reporting it. Yeah, well, there's no real place for them to report it, but they also may not want anybody to know so they can keep going to work.
So the other night, the president was interviewed and he said that, and I'm not saying it for that reason, but I guess I'm not sure that he spoke correctly, but he said the pandemic is over. So my question is, regardless of what he said, is there going to be a point where the pandemic is over and there'll be less of all of this and we're going to move on? I mean, I'm just curious what the state health department is saying, or what the position is of the state health department is, maybe versus the federal government, or where we're at and how this is all.
Well, the governor has removed the mask requirements and they're all just a recommendation. Everything's been removed from the schools. They're certainly acting like we're ready to move on from it. But the conversation these past couple of weeks is the anticipated spike happening when cold weather comes. So I understood what he was saying. It was disastrous in terms of the language, but I understand what he was saying because I think the biggest part of the pandemic is behind us, but I do think we're going to see spikes. And Dr. Fauci was on the news this morning. I haven't seen him in quite a while, talking about the fact that there's another variant waiting around the corner. So
Is that 4.6? Is that the BA 4.6 variant? Or?
I think that's what he didn't specifically mention that, but I think that's what it is.
It seems as time's going on, though, the effects of it, or the symptoms are much less. I mean, I know a lot of people that have tested positive for COVID recently, and it's more like a very minor cold. We haven't seen many in the hospital or in intensive care, or have we?
We have 11 in the hospital this morning, and nobody was in intensive care. Nobody was intubated, so I think it is a lot less. Commissioner?
Thanks. It's fair to say that in the cold weather, we see spikes of colds, we see spikes of flu. Is that the type of spike we're thinking about, or is this still exceed that?
Yeah, I think so. I think it's going to be, similar to the flu, and we're going to see spikes. And if I could project into next year, I would guess that we may have a booster that's supposed to last a year, and we all get it, and we still get COVID. And I think it's going to be with us a long time. It's a very successful virus. It mutates really well, and it gets its humans.
It's really become akin to, cold weather comes, we're going to see spikes in flu, and we'll see spikes in COVID.
Yes, I think that's, throughout the winter, we'll see it'll kind of roll along, and we'll get spikes, and it'll abate. We have more spikes, and it'll abate.
In that sense, that is it correct that the pandemic is over? We just sort of moved into like there's no flu pandemic per se. It's just very different variants of flu out there. Is this just another variant of something that is going to hang on and be around for generations, and it'll just be a seasonal thing?
I think it depends on how tight your definition of pandemic is. If you're an epidemiologist, it has to be stable. The flu is stable. We know what the numbers are. It's predictable. So an epidemiologist would say, no, it's not. The pandemic's not over because it's not stable.
Don't you also think that by saying that it's over, depress the number of people that would get the most recent variant vaccination? So that's the reason not to say it's over. It's not, you don't want to accelerate it or to overstate it, but you want people to get the bivariant vaccination.
Yes. Yeah.
And did he not remove the mask requirement if you've been exposed? If you don't have it, if you've been exposed, you no longer have to wear a mask.
Right. Yeah. It's recommended, but it's not required. Okay.
Any more questions for Mr. Matt? All right, thank you very much, sir. Thank you Supervisor Eldridge. Although I'm sure I'd like to, once you finish hosting this meeting.
It's my pleasure.
He did not have to pass the baton. Miss Amber Klein, Human Services.
Okay, we have 5 resolutions total. The first one, we had previously had a resolution approved to purchase an agency vehicle using federal salary share money. The resolution was for the amount of $30,000, and we received information from the dealership that the price point had changed. So we are asking to increase that amount to $31,351, and the difference will also come out of federal salary share.
Second.
Thank you.
Any further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, our second resolution is to continue our current contract with WellCare Insurance for reimbursement of our clinical services. This is a provider that we're already under contract with. We're just renewing.
I'll move it.
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Okay, our third resolution is to enter into a contract with Concilium, which is a locums tenens firm for recruitment services for psychiatrists. They approached us and, we are trying to overturn every stone that we can to find prescribers. So that's what this is. This will allow us to contract with them if need be.
Like a motion?
I'll move it. I'll second.
Discussion? All in favor?
This operates as basically a headhunt.
Correct. Yep.
Any opposed? Carried.
Okay, our last 2 resolutions are training requests. The first one is for a creative arts therapist who will be providing a full day training to our staff. The total cost of the training, including his fees and food for a group of approximately 15 staff, is $1,950. And these funds would come out of the funds that we received from OMH, which is specifically for training and recruitment of our staff.
Okay, can I get a motion?
Yes, I'll move it.
Second.
Discussion? All in favor?
Aye.
Aye. Opposed? Carried.
Okay, and the second training request would come out of the same budget line, the OMH money for training and recruitment of staff. This training is for mental wellness and suicide prevention, and it will be offered by Frank Pomada Consulting. It's a full day training that would have a total cost of $1,090.42.
Move it.
Discussion? All in favor?
Aye.
Opposed? Carried.
Okay, and then lastly is our overtime report. We have used approximately $3,000 to date of our overtime budget, which leaves just under $9,000 annually in our budget for overtime.
Any questions for Ms. Klein?
Okay.
Thank you.
Thank you very much.
Yeah.
Okay, Office of the Aging.
It's good afternoon. My name is Michelle.
Gotcha.
No, you're here all the time.
Yeah, that's what he said.
Yes.
I can do that.
We will.
Thank you.
Thank you very much.
And she's going to introduce herself. Also, most of us are used to seeing Mr. McDonald, but today we have
Michelle Cram, Assistant Administrator at the Office for the Aging. So we have 4 resolutions, and the first one is permission for the OFA to contract with the Columbia County Health Consortium to provide outreach and application services under the Medicare Improvements for Patients and Providers Act. This is something that we do every year, and the Healthcare Consortium staff who works on this goes out and assists people with MSP and extra help applications at the various town halls and senior sites.
Further discussion? All in favor?
Aye.
Aye. Opposed? Carried.
The next one is to amend the COVID-19 vaccines for older adults and people with disabilities contract with the Columbia County Health Department by extending the contract for 1 year. We received money through NYSOFA to help with this, and it was supposed to run out at the end of this month, and now they are extending it until September of 2023. And we have been in communication with Jack and with the health department about promoting this.
Discussion? All in favor?
Aye.
The third one is to accept $85,000 in additional unmet need funding. In 2021, NYSOFA provided an additional $85,000 for the unmet needs program in supplemental funding, with no guarantee, though, that it would be available thereafter. And now we have received word that it has. So we have it, up there on the screen how that $85,000 would be spent.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
And the last resolution, we're requesting permission to contract with a consultant for the Everholm Columbia pilot project. And I also wanted to note that we have Karen Wolf from Everholm here tonight to answer any questions anyone might have. But the consultant would perform a variety of tasks related to the project, including educating the community on the benefits of the project, assisting seniors in enrolling in the project, assisting seniors in obtaining necessary technology materials and equipment, and assistance in setup and installation of such items, and referring individuals to the Everholm program.
How is it the program going? How is the pilot doing? Do we have many people that are participating?
So we were off to a slow start because we're an integration app, and one of the pieces that we were integrating with, the company had gotten bought and sold, so we had to find another source, and that actually worked out for us because it was even better wellness tablet that we were able to bring on board. So the app went live in May. We were accepted with Apple and Google, so it came live and official in May. It's in people's homes. It's in we have 11 active cases in Columbia County. There's 5 pending. We are getting phone calls every day. People are hearing about it. We're actually starting to get calls from other locations too. We have other counties contacting us. We have insurance providers calling communities. The word is out there on what it's doing because it's starting to make an impact.
So if I recall, I don't remember what the original amount was that we were hoping to get, but
400 was the number.
No, but in the county, you weren't looking at that many, I don't recall, in this pilot program. And there were gonna be so many that were gonna be paid, so many that were gonna be, Medicare, so many were gonna be whatever, so many were gonna be whatever. Did you fill all those gaps and have people paying for the service?
We did have someone paying. What we did was, the Home for the Aged has funded a lot of this. We've given us a subsidy.
Right.
So we decided to base the subsidy on the ISA requirements to create standards like the Office for the Aging has. And most people that call us need that. So they come in at either between $0 or $220 a month. Private pay is $360 a month, which is still $13 a day. It's less than an hour home pay.
I'm sorry, but do you have any private pays?
We did have a private pay, yes.
Okay.
Yeah, and most are subsidized. Right now, we're offering 50 free, absolutely, not even looking at their financials, just to get more people into the program.
Thank you.
And you will be presenting tomorrow at
Yes.
1 p.m. at Grand Unity Drive to the Office of the Aging.
Yes.
Just so everyone's aware of that, the full presentation. Now, you're gonna bring in a customer testimonial?
I'm bringing a client, and the woman is 91 years old who uses that, and her daughter, and how it affects the caregiver and her. And there's a video on them too, if you don't, if you're not available tomorrow.
So 1 p.m. at the Fire Training Center, Grand Unity Drive. Supervisor Hoagland.
Two questions. Did I understand correctly? You said 50, the next 50 to sign up get it free even if they have a lot of money?
Yes.
You need people.
We're not even looking at financials because we need the data.
Okay.
The data is so important right now.
Second question, our senior rep, Mary Young, does an excellent job. She goes to every senior meeting, she comes to the town board meeting, she updates us all. Would it be helpful for her to arrange for you guys to come to our senior meeting? We have about 30 seniors that meet every other week. Not that Mary's not doing a good job, but to have you and, like you said, have the equipment, be able to show them hands-on.
We'd love to.
Okay, I'll get your contact and I'll connect you and Mary. Absolutely.
And how about sending a letter out to all the supervisors, you know, that we can present to our board, and maybe somebody's interested in having a presentation at our boards? Because I don't think that we were taking off as quickly as you had hoped.
Right.
And I was involved early on with the whole project, and I think it's a great idea. So, you know, if it's helpful, we may not get any hits, so why not send it out to all the supervisors?
Absolutely, we love that. Okay.
Did you know that, did I hear you say you moved from a desktop to a tablet?
It's a 17-inch touch screen. It is typically it can be portable. We don't want it to be portable though. We want it in one location. We want people to look at it like it's an appliance, their wellness appliance. Because if they start unplugging it and moving it, then they're gonna lose connectivity. You know, we don't want that. So it's really for one location.
And do you think it's taking off slow because you guys haven't done a good job marketing it? Or do you think there's some apprehension? What is the reason?
It's a blend of everything. It's kind of like when we first get this stuff, that new thing that comes out, everybody's afraid of being the first one, and what is it? And, you know, is it really going to be something that takes off, that is important to us? What, you know, it's that the newness to it. There's also with seniors can look at technology as being afraid of it. I know I've been afraid of technology. I've been afraid of telemedicine and utilizing it. You know, that fear of the unknown and not knowing how easy it is to really use. We have a 91-year-old woman who's never touched technology in her life, who's teaching others. She's like an expert on it. And also the difference with seniors is they might look at some of the pieces as it's taking away their independence. It's going to be monitoring me, and they're going to be looking at this. On the flip side, individuals with disabilities look at it as creating independence instead of taking it away. So it's really changing mindset that we want people to understand that this is going to help them stay safe and healthy and keep their independence. So
I think the technology piece is huge. A lot of our seniors have said, I don't even email. Why would I want this tech program? So I think that hands-on, you going there with the equipment and showing them how easy it is instead of, nope, it's electronic. I don't understand it. I think that's the key thing.
And the videos that we just did really help when they see someone using it, and if she can do it.
And that's another way I think the Office for the Aging helps, because you have a link to Mary and my time. They know all the senior reps and groups and as many like hands-on presentations that we can get them in front of.
And they have started doing that because we sent them all of the names of the reps and the numbers, and in fact, Karen and I ended up at the same presentation last week, the same club. I also want to note that on our OFA Facebook page, we do have the link to the video, so it'd be a great idea just to click on that and see. It does help explain it a lot more than the presentation did, I feel. So.
Yeah, it was really difficult, the presentation, to show how it really works up on the stage, and it was so new that they did a really nice job when they created the videos, and they're unscripted. It's people just talking genuinely.
We have a resolution on the floor. Can we get a motion? I'll move it. Second?
No second.
Further discussion? All in favor? Aye. Approved? Carried.
Thank you.
Thank you.
That's one other question. The home health aid program.
Yes.
How's that going? At last, I think you were through the waiting list completely.
We haven't had a waiting list, I think, in a couple months now. It's excellent. Yeah, it's really doing well.
And do you have the ability through that program or to extend that program? I, for example, have a resident in town that really needs a home health aid. They don't qualify financially. They pay out of pocket, but they can't find it. Can that be approached through your program at all, or do they have to be low income?
Well, I think it's worth a call to our office because if there's a cost share to it, we can still do it. They may just have a 90% cost share, but they still could do it through our office.
Okay.
So it's definitely worth a call.
Okay.
You're welcome.
And I'd like to thank Ms. Graham and all the OFA staff. I attended their event at Stuyvesant Landing and had a blast and ate well.
Thank you. Yeah, it was a good time.
Thank you.
Thank you.
Thank you.
And if Jack is here, I thank him for administering, his staff administering vaccination. All right. Commissioner Gibson, DSS, come on up, sir.
Hi, Mr. Gibson.
Good afternoon. Afternoon. I have a few resolution requests. The first one being a request to fill a caseworker position, grade 15, base salary $56,999, and any backfills created therefrom.
I'll move it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
The second request is to convert one clerk typist position, grade 10A, base salary $39,145, to one community service, also a grade 10A, base salary $39,145, and any backfills created therefrom. And many of you will recall that is a process that we've been going each time a clerk typist position becomes available. We convert it because the community services aide is able to perform more tasks and has a little more ability to take some initiative on some things.
You have a motion? Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
The third request is to abolish a part-time medical consultant position. That has been something that we find as we look at it more closely, those services could just as easily be performed on a per diem basis, and that would create quite a savings for the county.
I'll move it.
Do I have a second? Further discussion? All in favor?
Aye.
Opposed? Carried.
Also, like to request authorization to enter into an agreement with Grant Me Hope. That is a family and home finding agency. We're always looking for resources to find when we need to have children adopted out. You can never have enough resources. Hopefully you don't have to adopt out too often, but when you do, you like to have good resources to do that.
Do I have a motion?
I'll move.
Second? We'll get to discussion after this thing. Do I have a second?
Second.
On
Discussion.
schedule item, hearing on point 9, I think there's a verb missing.
Oh, that may well be. Let me get to that.
Will be all videos will be sent. And I will put into it.
Where's that from?
Page 15, point 9. I think there's a verb. That maybe it's vetted through. Agreed.
All right. And what number paragraph was it?
9.
Yeah, and I would imagine, and without knowing, so I cannot supply it, but I think it's probably reviewing, but I think what I'll do is take this back and have it amended, and I will send that to the clerk, and that can be sent out, and it can be subject to that change.
Are these a videotape
The video tape project.
It's part of that, yes.
That seems.
It's relatively new. I mean, it's
I'm just curious how you control that, or where those tapes go, and.
it's a difficult, that's a difficult question. And it's one where I fully support the process. I do. But again, remember, this is everybody consenting to and making sure that the children understand what that's like. Now, does it help? I think that it does. I think that children feel more comfortable. But, I've had pause in the past because for obvious reasons, you're involving children in something. So that is the project.
Is there a timeline associated with, at what point, how long the child has been in the system that before you consider a video? Or is a video something that would be in the need of time to?
You leave that to the consultants, quite frankly. That's what they do, and I sort of follow the lead of the folks that I trust on that. Unfortunately, and you have, for whatever reason, more or less success adopting out some children. There's just certain factors that go into that, and so you enlist the aid of experts and consultants all across the country and the world who have looked at this from every different angle. So what I would say is, personally, as somebody leading an agency, I'm hoping that it's not the first step, and it's generally not the first step, but it's a step that has proven to work.
One last question.
Sure.
It talks about a consent, but it doesn't say whose consent. Who gives the consent to that child or the agency?
The agency gives the person in custody at that point in time, but I would tell you that's in full consultation with the child.
Okay, any further questions?
How many kids are adopted out in a year?
In a given year, it can be as little as or as few as 2 or 3. We've had years where it's been in excess of 10, depending on the size. What we shoot for is 0, and that's not because we don't want to adopt children into homes. It's because we prefer if they're with their families. Yeah.
Okay, can we go ahead and vote on this resolution with the idea that there be clarification of Schedule A, Section A, subsection 9?
We have a motion.
Yeah, we have a motion in a second.
Yep.
Well,
Yeah. Go ahead and vote. All in favor?
Aye.
Opposed? Carried.
Thank you. Now, if I might, I'd like to move on to the discussion that I put with transportation. I had and I brought this to the committee before and let them know. I don't think so, but it's certainly your call. I'm not going to get into it point by point. I just
well, it's contractual, so
right with no.
It has to do with personal.
It does. I'm just at the discussion phase. I'm happy to go into executive though.
Yeah,
But this is what you have the board about going into executive session, correct?
that's I'm thinking.
Sure.
Yeah.
Well, in case things go into the rhubarb, we can
Sure.
get a motion to discuss the personal, financial, credit, or employment history of a particular person or corporation.
I'll make the motion.
We got it.
You got it.
All in favor?
Aye.
Who's running the video feed? Anybody?
Oswaldo is. Are we good to go, Oswaldo? We're going to executive?
very much, Commissioner Gibson.
Thank you.
Chair, could I just ask a quick unrelated question?
Sure.
I have a lot of residents that have been now because gas and fuel prices are so high. A lot of my residents are, $100 too much for heat, or maybe $200 too much for heat. They're right there, and with the increase in gas and heating costs, they're afraid they won't be able to house this winter. Has there been any discussion on a higher up level of changing the heat qualification levels due to the increase in the cost?
Well, there hasn't been any of that discussion. There's been an increase, I would tell you, because prices have been up, and they were up at the end of last season. But no memos come to past my desk that says, "Hey, we're going to lower the standards on this," or "We're going to allow." Typically, what they'll say is they'll go up a percentage, so they'll go to 150% poverty level or 200%. But what I could do is just keep this committee and all supervisors apprised of that. We would do that and send it out to every supervisor. What I would say is don't hesitate to call with a family in need, because there's typically other programs. Remember, we have emergency programs that we run that are aside from HEAP. So if people can't fill their oil tanks, we have a set aside for that.
Okay, and I'm going to give you a call because we're actually, as a town, again, we might allocate some ARPA funds to it, and so we're going to work with our local fuel companies, with you. Maybe some people qualify for heat, they don't realize it, but for that gap in between, maybe we can collaborate and make the money stretch further, where the town chips in a little bit, you chip in a little bit. Okay.
And that's what it is there for the gap. Okay. Because typically you're going out on emergency for folks who didn't qualify for heat.
Okay, thank you.
I just had one question. It looked like there was a spike in reported cases per report.
Well, what you're seeing is a seasonal change now. So there's a little bit. I would expect that to be much more of a spike in the months to come.
Okay. Any further questions?
Is the income level for heat, is state established?
Federal.
Federal, okay.
It's state administered, federal granted.
Thank you.
If you like, I'll send that out to you tomorrow with the guideline, the up-to-date guidelines. Thanks, folks.
Oh,
I'm sorry.
do you want to update what we had talked about concerning the assisted living program that we had taken?
I'd love to.
Okay. I worked with Commissioner Gibson for the assisted living program, and we worked with 3 counties on DSS on the Hopelands program for placement, and I brought it to Mr. Gibson, Commissioner Gibson, and we had a meeting. We met with the homeless, and the APS directors, and we had we can't take everyone. Not everyone meets the criteria to be able to come into an assisted living, which is like a dormitory kind of setting. And we've had a really successful admission. I'm very happy with that, and don't let another. So that's what.
No, it's an incredible resource. When Supervisor Eldridge brought this up to us, because we've had such difficulty finding permanent housing. These are folks that this is permanent housing for them, and what's not to really admire about this? Not only does it provide that, and it provides community, but then there's a whole nother funding source for it. So it relieves the taxpayers of the county. I mean, it really is.
And they're safe, and get the 3 meals and the medication and all their housekeeping needs, anything, the laundry's done, anything that they need, and it's clean. And
no, we're thrilled, and so going forward, we're thrilled to continue to work with you, staff.
Availability as well as the tax.
Thanks so much. I appreciate
so
it.
welcome, and I appreciate it, Father.
Yeah, well, that's great. Thanks, folks.
Thank you, sir. All right, last item on the agenda, we had the youth director discussion. Chairman Morella, you were in conversation with civil service.
Yeah, we sent out the job specs to everyone on the video.
It's got right there.
Oh. Make copies of the job specs. I believe, yeah, Bob, actually Bob worked on it with his, Bob wrote it. Actually, this was the civil service spectrum. Thanks, sir. Minimal qualifications. So.
Ma'am, would you like a copy of this? It's discussing the youth director.
So we could write nothing. We believe it's ready to go. We just wanted to run it through committee to be able to advertise. At least start interview process to get some names and interested people who may have.
I just, if I could, Chairman, I had just a question on it, because I know we've been discussing a director that would come into the line of the Department of Social Services.
Yes.
Okay. We spoke, Chairman, there'd be some other duties we would like to add to it. I don't know them.
Well, I think they would fit under this umbrella.
Okay, very good. That's what we were, if they would fit under there, then that would come out at the interview process. That's fine.
Chairman, can I ask the question just on process? Would this committee have to adopt this job description before?
No, civil service adopted.
Okay, would you be okay with the two new members to the committee that I had given you recommendations for? Just also, I'm gonna set eyes on it before I get some paper.
Well, I was gonna do one, which would have been clear.
Okay, do you mind just sending?
Because I put my phone in computer. So,
yes.
So.
Okay, do you mind just emailing this to Claire, having Kelly or Denal email it to Claire, because she did mention that before this goes out, she'd love to just look at it. Okay, awesome, thank you.
And again, this was adopted by civil service. So
right.
The only thing that changed in this from what it has been over the years is we had the associates to do as a minimum. Everything else was.
Well, the other thing, Chairman, as I looked at it with my attorney, it looks like if we are going to put it in the line at DSS, we might have to change the report part of that. They put the commissioner in because it says the board. If you look at the top, and in the future, I would imagine the board just wants this to be self-sustained within the department. So that's an easy enough change.
Well, it has to go back through the commission.
Which would mean at the beginning of the week.
I don't know.
I think they meet the first week of the month. If that's not too much, or we could just.
We could always.
Amend it down the road.
And change it.
Yeah, that's fine.
I don't want to slow the process only because I'd like to get somebody in there and start training because you're going to get municipal claims and stuff through. We want some of the point person there.
Yeah, the state has already reached out and we told them that just to let us abide this process. But yeah, no question. Yeah, as long as that's something we can address it shortly after we get going. And again, if we make that clear at the interview process, I'm fine with that.
Bob, are you just saying under sentence 2 where it says under the direct supervision of the Columbia County Youth Advisory Board and the Commissioner of DSS?
Yeah, because then I'm just going to put it under a deputy and so on and so forth.
And then it'll come to this committee through your committee.
For me, yeah, well.
There would still have to be a chain from the director to the board supervisor.
I wonder, I would actually love for,
on regs.
I would love for County Board of Supervisors to stay in there and just also add the commissioner as opposed to replacing, if that's okay.
That's not a problem as long as we're clear on the report for the person because there'll be a DSS employee.
Right.
You know, Bob could be that chain. I mean, he could report on the department director. Themselves.
Yeah, no, that's what we anticipated and just putting it out there. I thought on a quarterly basis I would actually bring that director to the committee. Otherwise, I would, and that director would be involved with the budget, that part of the budget. Yeah, so there's a lot that can happen there.
Why would you want to leave the board of supervisors in?
So one of my requests at the last meeting was that we consider it being a standalone position similar to Office for the Aging. And the chairman had some great points about the infrastructure that already exists within DSS, administrative staff, computers, office space, all of those things. But I do think it's important, this position as a town supervisor for our summer camp, it really is a position that not that I can't always go through Bob, Bob's great, but I would also like that direct, again, they're under Bob's department, but there's also, like he said, at least 4 times a year or something coming directly to the supervisors, to keep that direct communication there as well. Bob's department's a very big department. I just don't want it to get kind of
Well, and more so than
brought under and
more so than that, supervisor, there would be direct. So this person will be responsible to communicate with all town supervisors and their clerks
Right.
to help run their summer programs,
Right.
solve some of the problems we came up with last summer, now more directly. So, and we will be doing those board meetings right at the department. And anybody, any supervisor can come to those. So that's absolutely part of the new specs for this.
So I could just remind, because this is new to me, so historically, we have supervised the preparation and maintenance of records on juvenile offenses, effectiveness of programs and treatment, and we've also provided personal counseling. I didn't realize our past employee provided either of those services.
That was the past employee.
I think we're trying to expand this.
I understand, but I heard earlier that this was essentially the same, that it hadn't changed.
No, it hadn't changed. That was in there previously.
We hadn't provided the service.
We used to do for years, when I did it, we used to do kids diversion, which was
Okay.
working with families and parents. And
So now we're getting more in compliance with where we should be.
well, it's
It's putting somebody in a position that should be doing all of these things.
not every volunteer has to be done, but it's the scope of the position as was laid down by the state.
Well, that's what I'm trying to understand, so thank you for your patience. I just wanted to, would that be the majority of the work? How do you, I mean, this is a pretty broad.
There's a lot of support within the department.
Okay.
We will be hitting all of those, but
Okay.
this will be one of several directors, and they work as a group, and they're under a deputy commissioner, and they report to the commissioner. There will be, we're excited about it.
So and I see that the qualifications agree with the job spec, which is great, but I just was concerned that we wanted to, especially if we were making a commitment to this, we wanted to set this job up to succeed. We didn't want to get somebody too much to do.
We're gonna break that.
And I understand the gaps we have in fire.
Also, I'm just, I guess my concern is that not everybody wants to go to DSS for these services.
So,
How do we-
so excellent point.
How do we keep that so it's a much more, I mean, you need a lot of help, clearly. And how do we get more involvement inside? It's the issue of how one perceives it.
It very much is, and this person, there are going to be times where they're out in every community, they're out in every town. So it will take on some of the air that the director, when it was a standalone, they'll be out at some of these programs. But perhaps you'll want that person to come to a town board meeting, or something like that. So, no, it's a very good point. And by the way, we see it as a very preventive measure, but it came up in our discussions that it's for all youth in the county. It's definitely for youth at risk, but it's for all youth in the county. So we want to make that more vibrant.
I think that point is extremely valid, and that we've had these discussions about this position. That's the point, but I don't think that the public. I mean, it's how we end up presenting this person to the public. I don't think it has to be presented under the guise of DSS either. I mean, it's just that DSS is going to provide all of the support that wasn't there before. I don't want to get into the last person, but it doesn't have to be presented that way because I want this person to be dynamic and out there in the community and easily accessible and doing a lot more than they were doing. But I think when we talked about this and we put a lot of time into this, actually the support staff that's where they can be much better supervised and watched. But we have to decide how we're going to present that person to the public, to the community, to the board of supervisors, And that's the goal of this position. And as a matter of fact, we had a discussion about leaving this or making this position part-time, which nobody in that group was interested in. You know, we want to see this person do a lot more than what's going on. Yeah.
Well, for example, if I want to encourage young people in the community to engage with community college, for example, I mean, that's part of what we spend a lot of money on the college, and it would behoove us to encourage the community, young people, to get involved there. So those are things that I think, or, I mean, there's a tremendous amount of grants for places, like, and then how does the granting process. I mean, it's a big job, ultimately.
It is a big
I don't
job.
want it to get too narrow, so I just.
No, I think that's a great point. You know, in other words, I have director of services. That particular position is out often in the community. It's at schools. It's in other areas where they're developing programs for you. I had all the directors have that sort of autonomy and different job description. This particular person, whoever it may end up being, will be directed in that way. So there's no question about this. It's a good question, and that's a definitive answer to that. Is absolutely.
I mean, my hope was that it's as important as the office of aging. Whether we put it under the office of aging or not, but that person is identified with leading and generating excitement for the youth of our county is equal to the seniors in our county. So that's my hope.
Yeah, no, it's a good hope. And remember, there are a lot of great youth programs, and you just need those networked correctly. They're looking for organization. They're on the youth board. And you're trying to generate and build this up. And I think that is where we can give it some capacity.
I really like that this is much more focused on program than management. There's a lot of good program ideas here, and we'd love to see those programs exist here.
I have a question / request with, I guess, the chairman and you. I think, you know, as I hear Supervisor Musman speaking, and she's got all these great ideas, and I've got ideas because I know what's needed in New London, and because this position is so directly related with towns in the city as well. Once this person is hired, I'm hoping maybe we could have a special workshop, maybe not media, I mean, it would be public but a workshopping group where you would come and this person would come and they would express some of their ideas, and then we as supervisors also could bring up some different ideas, or people in our community would connect this person with and really kind of, you know, let them get their feet under them first, don't do it like the first week they're on the job, but, you know, a month or certainly before next summer camp season is coming in, maybe next spring, just have kind of a you know, brainstorming workshop with them to help guide some of their work.
I also think, I don't think, it's why we sort of changed the educational requirements, because, you know, you could find somebody that's dynamic, that has a lot of energy and experience, that has an associate's degree. We didn't want to pigeonhole this position, because, I see this position exactly as Linda sees it. Somebody out in the community, somebody with a lot of energy, excited to do this. So yeah, I don't see any issue with that. And I don't even know, we haven't talked about it, but maybe that person could once a week be down here at 401, you know, so people could have access to that person.
Connect them with all the superintendents of the schools, so they,
that's why we made it full time, and you know,
through the resident deputy who knows the students, and, you know, get them really involved. Great.
Alright, so we'll go to advertising.
Well, we're gonna make the one change in the Commissioner of Social Services. And they're just based on timing, and then once that gets approved, we can probably advertise it.
We didn't set a salary yet, correct?
I think it's budgeted at 60, so.
Yeah.
Somewhere in the 60s, but I don't know that we specifically.
I set it as a range.
Right.
And I put it into the
23 budget.
Yeah, I put those, I can't pronounce the worksheet, the budget worksheet.
We haven't seen your worksheet yet, I don't think.
May or may not, it's in, but, you know.
We haven't seen it yet.
What is the office of the agent?
I didn't notice that.
I haven't seen his budget worksheets yet.
Okay.
Yeah,
You got the gym list.
Yeah, they're all in, and so we're just waiting for a convenient time, I think, and the supervisor who would like to attend that, you're welcome.
I would certainly. All right. Anything else on the youth director discussion?
So I guess just we're looking for a motion we don't need a resolution once we make the changes to advertise.
Okay,
The salary range.
motion to advertise contingent to the changes to the header of the youth description.
I'll move it.
All in favor?
Aye.
Opposed? Carried.
It's so exciting, thank you. Thank you.
Well, let's hope that this person can get out there, because there's so many camps and so many kids.
Let's just hope we get it.
As Supervisor Mussman said, we should put as much emphasis on this as we do on the aging.
I think there would be some inside by their own agency and students, so I don't think we'll have a problem attracting people who are.
And what's the timeline for having somebody on board? Before the end of the year? Whatever the market there.
Process for him.
Whatever the market there.
We gotta give some time for people to respond, hopefully before the end of the year.
All right.
Yeah, that's.
Anything else? Do we have any questions from the public?
Here.
Do we have any questions from the public? Young lady in the back row?
Well, I was going to ask Mr. For more details about the thing about adoption, because I didn't really hear well see the proposal on that you had about the adoption thing. I guess the best thing would be for me to read the proposal, that the proposed resolution you had about the adoption, and then I will probably have some questions.
Okay,
Can you understand me? Did I speak clearly?
yeah, sure. It was contracting with an agency to facilitate the adoption of youth in the county, correct?
Yes, yeah.
I'll be happy to answer.
All right, okay. And I also have some questions that were not related to anything that was discussed here, so.
Okay. Sure. And I'll see.
All right.
Motion to adjourn.
Do I have a second? Second. All in favor?
Aye.
Good night, everybody. Thank you.
Thank you.